Welcome to Wellness. Today we're going to go over one of our favorite topics, something that I've been doing for quite a few years now, and that is pain management. Interventional pain management without the use of opioids and helping control your pain. Over the years, I have created multiple products and treatment strategies that have been extremely successful in helping lots of people get their chronic pain and even their acute pain under control so that they are able to function better and without the use of opioids that can of course have their wonderful side effects. This is an area that is near and dear to me as I watched my own family members suffer with chronic pain issues and have always wanted to do something to make sure that others didn't have to suffer through watching their loved ones go through so much pain. So one area that I really want to touch base on the most is the use of topical medications and some oil tinctures. I don't think these are used nearly as much as they should be. I think finding the right combinations are critical. We have advanced from things like, as many people will recall, Bengay and sports creams onto Voltaren gel most recently that has gone over the counter to help improve upon pain relief from a topical standpoint, from the muscle aches and even the simple joint arthritic changes. These are invaluable, should be utilized. The biggest reason why is they're a topical. They do not go through your system. They are not going to upset your stomach. Which is so important. So many people cannot tolerate certain medications because of what it will do to the lining of their stomach and cause them to have ulcers and all kinds of fun things that they don't really want to deal with. Terrible GI side effects. They can also cause damage to the kidneys. Again, nothing we really want to deal with. When we talk about topicals, we are avoiding those problems and those threats to the body. In recent years, probably the last 10, and probably more popular in the last 7, is the use of CBD creams and oils. This has gone through the roof, and so many people utilizing gummy bears, creams, oils, all kinds of topics that the CBD has been proven to be helpful for. In the United States alone, there are several states where it is now, of course, legal to grow and cultivate marijuana, and they utilize the THC, which is in the stem. And I guess that's one thing that should probably be best explained for those of you going, you know, what really is CBD? Well, what does that actually mean? Well, what that is it's the oil and the stem of the marijuana plant, the cannabis plant. The THC, which is the active ingredient that causes the hallucinations and the euphoric feeling, are found in the oils of the stem going into the actual leaf. The CBD oil that we see and utilize for pain relief and such that you can find at CVS is all found in the stem of the plant. It will have a small 0.03% THC value to it, but no significant change or altered mental status. It doesn't show up in a urine drug screen and so on that many people are very, very concerned about. But what it does do, and what it is important to note, and the 3 things I will tell you now that I can attest to from utilizing the CBD oils in my treatment strategies is, 1, it does have amazing pain relieving properties. When you utilize the oil in a sublingual, meaning underneath the tongue, hold it for as long as you can before you swallow it, it will give you a global relief of pain, meaning all over your body. So for those that are suffering from global conditions like lupus arthritis, rheumatoid arthritis, and things along those lines, trying to figure out, I've got so many joints and so many painful areas, how do I get them all? Is there enough cream to rub on me? Well, this is where a oil that you can use sublingually becomes invaluable. These oils not only will help with pain relief, I will tell you now they will also improve anxiety states, dramatically improve anxiety states. And the third, and probably just as important as anything else, is it will help improve the ability to sleep. People that may suffer from insomnia or sleeping disorders at night where they're waking and having disrupted sleep, this will help you fall asleep and stay asleep. When you combine all three of those things, there are many of you going, holy cow, that's totally me. Yeah, not surprising. This is very common in the United States, very common. And we accept, oh, I just don't know what to do. Oh, how am I ever going to find another way? Well, there are ways. There are ways to treat it. There are ways to treat it without utilizing a benzodiazepine or an opioid medication. The oils are pretty impressive. The oil that we utilize, I get from Spain. It's not done here, it's not raised here in this country, it's in a different climate, it's cultivated differently, and it is extremely impressive for the results that I'm seeing. We have also combinationed a cream. Our cream is a CBD-rich cream, but what it has that you cannot find anywhere else is it's mixed with arnica oil, which many of you know is another plant found in the northwest United States, emu oil, which is the fat from the emu bird, the CBD oil that I mentioned that we get ours coming from Spain, and many of you will smile when you hear this, but believe it or not, eucalyptus, which for those of us that might be a little bit experienced having used eucalyptus as a kid, that it was originally designed to help with body aches before we started realizing how well it could open up the sinuses. So eucalyptus has been used for decades as a pain relieving medication. Personally, I love the smell. Some people aren't so fond of it, but it does help enhance the product dramatically. This combo of these three oils for this cream is amazing. It's like nothing it can explain. It has worked on painful conditions such as diabetic neuropathy. I've had many patients be able to get sensation back in their feet and feel the carpet. I've actually cried with them when they couldn't believe for 10 years they hadn't felt the carpet, and here they are able to feel it. I know Kara is sitting here going, yes, I've seen this with him, but it's pretty impressive how well this works.
Yeah, it really is. There are so many. We always have the philosophy of starting simply, trying the easy things first. And so this cream and oil all plays into that. It really is a natural way with no negative side effects. It doesn't have any THC, so you're never going to have the loopy feeling that THC brings on. Mm-hmm. So euphoric, yes. So you only get the good aspects of CBD. And we have patients that just can't stop raving about it and use it daily, religiously. But the great thing about it is once you start using it, your body kind of gets in line and you have to use less and less. So how often are you on any kind of treatment plan where over time you need less of it? It just doesn't happen. So, but that's the great thing about the CBD cream it becomes a part of your day, but then over time you're just like, hey, I really only felt like I needed it twice today instead of 3 times, or maybe once, and slowly you'll feel better naturally on your own.
Yeah.
So that's a big part of everything we do, though, is trying to do the minimum to get the maximum results. We don't ever jump right to a high level treatment. We want to start small, and a lot of times you get great results with doing the minimum. So you can always go further, but why do something stronger than you need to get the results?
Absolutely. Agree 100%. That's the part that I enjoy the most. So many people going, oh, well, I didn't even need an injection. That's fantastic. My goals are to try and get you the best relief of pain for the minimal amount of interventional treatment that I need to provide. And that being said, as Kara had mentioned, the CBD creams and oils needing less, well, it's because your body has so many CBD receptors in it. And that is a huge, huge reason why I'm using this 3 times a day for the first 3 to 4 weeks. Next thing I know, I'm really only needing it twice a day. Just as she said, it's pretty impressive from that standpoint. What we also do is when we talk about working with people with pain, and we're talking about these CBD creams and oils, is because the cream is a water-soluble cream, it can be utilized with ultrasound. Now, not the one that lets you see how your baby's growing, but the ultrasound that's therapeutic. Now, that ultrasound can help make that, or to help get that cream to be driven deeper within the tissue, going into deeper muscles and even helping calm down nerve endings. And I've used that multiple times when writing prescriptions for physical therapy. Please utilize this cream in your treatment strategies. And over the years, I've actually had physical therapists buy these bottles of cream because they've seen such amazing results in getting their people walking or moving their arms. One thing that I've always boasted on is I really want that physical therapist to be your cheerleader and not your taskmaster. And if I can get your pain better controlled, we can see the improvement of function go up dramatically, and that's something we've observed over the years. That does make a huge difference in someone's life. If it comes down to we really need to do an injection, for example, of a shoulder or a knee, or maybe even an ankle, where you've got a lot of arthritic change. The creams and oils are helping some, but it's just not as ideal as what you were hoping for. There are plenty of amazing options from that standpoint. Everyone goes, "Oh, are you just going to use a steroid?" No, not always. I utilize different strategies and techniques. People will tell me flat out, "Well, I've had a steroid injection and it doesn't help." Okay, so steroids don't work as well for you. Are there other things? Absolutely. And as a wellness, a focus on a wellness type practice that we do, I'm looking at what other alternatives are out there. And 2 that come to mind right off the top of my head are a medication called Trameal and another one called Zeal. These 2 medications are an all-natural anti-inflammatory approach derived from different roots and barks and plants, and have actually gone in head-to-head studies that the NIH, National Institute of Health, has looked at up against steroid, your dexamethazones, your kinalogs, what have you, and they have seen the same results with pain relief, length of time that it lasts, but fewer side effects, which is dramatic. And the NIH backs and supports this.
And it's great also, the Trameal and Zeal is great for diabetics.
Absolutely.
Who traditionally, it's like, well, I'm not going to take a steroid because I'm concerned about the adjustment to my blood sugar. These all-natural alternatives alleviate the concern about that.
Absolutely.
So it
Excellent
makes
point.
pain relief available to people who previously weren't going to be eligible just for fear of, or having to monitor so closely how their blood sugar was going to be affected by the steroid.
And speaking to that kind of that note, when we talk about doing an injection for Trameal and or Zeal, and we're talking about either a simple joint injection or maybe we're talking about a trigger point injection to the muscles, one thing that's really nice is if I do a steroid injection, I can't put you really on steroids for a few more days. We're going to see all kinds of yucky side effects. Could be upset stomach, could be sugars being bumped up if you're a diabetic, but I can have you order a bottle of Trameal and or Zeal from an Amazon or another website, as they are. There is an oral form of this medication to continue those same types of pain relieving properties. So it really can be beneficial from that standpoint. When you combine those injections with our creams, our success rate is approximately 95+% in getting relief of pain. And success is measured in multiple ways. My measurement of success when I say that is 50% or greater relief in pain, lasting, if we're talking about creams and oils, 6 to 18 hours. If we're talking about injections combined with the oils, 2 to 6, sometimes as many as 3 months, up to possibly 4 or 5 months, but 2 to 6 months fairly easily, based on your condition as well as length of time, which all, of course, would need to be discussed in detail. So these are outstanding, fantastic ways of feeling significantly better without the use of heavy medications. And for us, there's just nothing better than that. Kara, I know you've watched, multiple times different strategies and have just been as surprised as I have as how impressively well things have worked for people.
Yeah. Well, and it's different people react differently to different treatments. So that's why, we start with what we think is going to work, but then we always have other plans on if the first attempt doesn't work, we'll pull the next item out. And we're just not, it's not a one size fits all.
Sure.
So we take as educated determination to begin with on what we think will be the right thing, but if that doesn't work, we try something else. And we are not subscribing in any way to the philosophy that pain is a part of aging. It
does happen,
comes, but there are ways to treat it, alleviate it, minimize it, at least.
Absolutely.
So that's our goal. And so beyond, being turning point wellness, we also are looking at other ways we can improve patients' lives. So.
Absolutely. Multiple treatment strategies available, including IV therapies, along with some of the other therapies that we offer within the clinic, including in the hyperbaric chamber, for those that may have seen the episode before. All these strategies can come together to really help improve your overall wellness and how you're feeling and what we can do to help make you feel better for the future. Again, there are lots of different strategies out there, some homeopathic, some traditional. I've used Toradol, which is another great anti-inflammatory. There's plenty of different things that we can do to really improve upon your overall wellness, especially if we're talking about pain management. There are lots of strategies. Given opportunities, I think you'd be quite surprised on how well these things can work. I can work on any part of the body, from the foot to the neck, even the base of the skull for chronic headaches. There's lots of strategies that can be done to help improve your conditions. So part of what we look forward to in the future is seeing a growing future within the CBD community, finding additional medications and homeopathic approaches to mix with our CBD creams. One that I find to be interesting that I've done that's pretty impressive is I've used capsaicin. For those of you going, capsaicin, why do I know that name? Well, that's because it's been around for at least 40 years that I can think of. It's a cream, pain-relieving cream, that, believe it or not, was made from hot peppers. I've used that combined with our CBD cream and have seen dramatic improvements, and including treating conditions like Raynaud's. For those that might not be familiar, Raynaud's is where the tips of the fingers and the tips of the toes can turn almost to purple because they're so cold. And the reason being is the circulation going into the hands becomes significantly diminished through a natural phenomenon where the blood vessels that are supplying the blood there shrink up dramatically. And people's fingertips will turn almost a purple color. And they are so painful and it is so cold. I have used this on some of our older folks' feet and hands and seen that turn dramatically, where they're getting this feeling of warmth and sensation back to their fingers. This is part of what pain management and a wellness clinic is doing, is we're thinking through what sorts of things do we know that we can put together to come up with maybe something that's a totally different ballgame than what anyone else has thought of or presented to you. I know plenty of rheumatologists that I've spoken with that have been like, I love what you're doing. I love it. It's such a huge advantage to know that there's somebody else out there trying to help my patients. Their focus, of course, is on many other things. But when you talk to them and they're seeing they're thrilled that they have an alternative to send their patients to, it's a big deal. And that's some of the things that we've noticed.
Yeah, there aren't too many clinics or providers that think outside of the box. And not only if we run into something that doesn't fit one of the protocols that we have, you're always researching to find something additional, like maybe another piece that we could add. That's how we developed the CBD cream, was by seeing a need from our patients for an alternative, something that they could manage themselves. When you wake up in the middle of the night and you're in pain, you can't really call your wellness clinic and see if you can get in for an injection. You need something that you can do at the moment, and that's where the need for our cream came in, and that's why we developed it. So it's really it's such a tool, and that's the unique nature of our clinic, is that we have so many different options for pain. Anything that is making you feel not your most ideal, we want to help diminish that, increase your wellness, and just give you the tools to feel your best.
Absolutely, absolutely. Again, having developed some pain IVs and some energy IVs and boosters that we'll talk about at a future date, these all kind of go in combination with how we can help people that are suffering from some painful conditions where they're telling us nothing has worked. What can you do? Is there something you can do? And I want to sit back and say, let's sort this out, and let's talk about what you've gone through, and let's talk about the things that you've already tried, and look at what future options do we have for you. I'm like you. I don't want you stuck on medication. You don't want to be stuck on it. If we have some strategies that can make a difference, and I have some orders that can be made a little bit different when it comes to even a therapist working with you from a physical or occupational standpoint, let's make it happen. There's lots of things that we can do to really make a blast as to, hey, I've got a glimmer of hope. I've seen that with patients even most recently. I have recently had a rheumatoid arthritis patient who, when I first met him, looked defeated. And we were meeting him for another purpose. And it came up that I had done pain management. And he said, do you think there's anything you could do for me? Because I don't know where I'm going to go. And he's at the beginning stages. And I'm like, yes, let's talk about what we can do for you. And last time I saw him just the other day, he had hope on his face again. He really did. He couldn't believe he could be out of pain. He couldn't believe that his pain had dropped from a 7 to a 2. I mean, that's a huge drop. He does know that it's there, but he barely recognizes it. And he's no longer looks defeated. He looks like he's ready to take on the world again. So it's kind of exciting. These things can be, really great for the future. And I really hope that if this is something that you're interested in, please let us know. Give us a call.
You can reach out to us via phone, email, Facebook. There's just a multitude of ways. So there's so much that we can do for people, and especially when we have patients come in that have lost hope. That's where it's so rewarding to be like, there is still hope. We're going to work through this with you and get you to feeling better. It's we never give up on our patients.
No, it's really hard. That's something that, hey, I'm going to think through, what are we going to do next? And very few times have we had to look at, hey, we're really kind of out of strategies. Let's stick with one thing we know has minimized it, but that's very infrequent.
Yeah.
But even those people were still noticing.
Well, and a decrease in pain is still an improvement. It may be that pain is just unfortunately never going to be completely gone.
Yeah.
But if we can decrease it, that still is an improvement.
And all of them had a reduction in pain. I know they were hoping for more, but they still got a reduction. So we'll work with people, and as newer strategies come about, we will certainly reach back out and say, hey, look, I know that you're doing okay, and I know you were disappointed we didn't have less, but we have something new that's come out. And so that's the beauty part of medicine. It's always changing.
Yep, ever evolving.
And ever evolving. The only thing that may change faster are computers, but medicine's right behind it with its speed and how we improve. So that's exciting. So don't give up. There's no reason to.
I think that's the overarching thing we try to instill in all of our patients is don't give up, keep moving forward.
Absolutely.
And trying the new things that come along. Because people respond differently to every treatment out there. And you just, until you have literally tried it all, you don't know which one is going to produce a much better result than you would have thought. Because just like our patient that you were discussing, the rheumatoid arthritis, he was sure there was nothing we could do for him.
Nope.
Convinced.
Nope. No.
And
he wasn't going to get rid of his pain.
What do you say? Hold my beer.
Yeah, exactly. Here, hold my beer. Let me tell you what I can do next. And that's where he's looking forward to great things for the future. Beyond even our cream and injections, there are some other things that he's looking forward to help and improve his conditions as well. So give us a shot. I don't think you'll be disappointed. I really don't. So thank you all for being here and listening to us today.
Yeah.
Again, if you have any questions, concerns, thoughts, or ideas, you want to bounce them off me, send us a message.
Yep. We would love to help you in any way we possibly can. That's why we're here.
That's right.
And very passionate about improving people's lives.
Thanks for watching. Have yourselves a great day.
Thanks.